This is an information update brought to you by Wang Vision Institute.
LASIK surgery has revolutionized the lives of many American citizens. Recently, we have had the opportunity to publish two major textbooks in the field. One is a textbook called Irregular Astigmatism, and that's the first textbook ever published in the world that deals with the major LASIK complication, irregular cornea. And the other textbook we have published also not long ago is called Cornea Topography. And that's a textbook describing the major technology to image the cornea in LASIK. So as we know, LASIK surgery has done wonders, has freed up patients from dependence on glasses and contact lenses. However, it is very important to remember, LASIK surgery, just like any other surgeries, has risk of complications. So as an average consumer, a patient, how can one determine how to go about in finding out if one is a candidate or should one have surgery? By publishing these textbooks, we want to bring up the level of public education, the education for doctors from around the world, to illustrate to them how important that one has to master the right technology and the right tools enabled to provide the best vision for our patients. So with the publication of these two recent textbooks in the world, that we feel we can help doctors train and for patients to find out more information about LASIK eye surgery. Remember, the key for LASIK eye surgery is safety.
For more information, call 615-321-8881 or wangvisioninstitute.com. This is an information update brought to you by Wang Vision Institute.
Last week, we talked about the general principle of LASIK eye surgery. And we talked about the publication of our recent two textbooks. One is called Irregular Astigmatism. That's the world's first textbook ever published that is dedicated to the subject of treating this most important LASIK complications. And also our textbook, which was published last year, about cornea topography, the main imaging technology. Today I want to spend some time to talk about, as a prospective patient, what should you think about if you want to consider LASIK eye surgery? This is a model of an eyeball. LASIK eye surgery works by reshaping the cornea into the shape of contact lenses, so you don't have to wear them and you can still see well. So three things are most important as a potential patient. First, you have to be the right candidate. Not everyone is a candidate for LASIK surgery. Second, you have to have the right technology. Current technology is a bladeless all laser surgery, complete do away without blade. And the third is the surgeon. One time I have a patient ask me, she said, what's the big deal difference doing LASIK surgery from one doctor to another? You know, it's the same principle of surgery. And I asked her that playing golf is the same principle. You throw the little ball in the hole. So what's the big deal difference playing golf between you and Tiger Woods? So just like everything we do as human beings, depends how we do it. So in summary, for LASIK eye surgery, three criteria: right patient, right technology, and right doctor.
For more information, call 615-321-8881 or wangvisioninstitute.com. This is an information update brought to you by Wang Vision Institute.
Last week, we talked about the preoperative consideration for LASIK eye surgery. This week, we'll talk about the surgery itself. We have recently published two major textbooks in the LASIK eye surgery field. One is called Irregular Astigmatism. One is called Cornea Topography. Both are now considered as authoritative textbooks in the LASIK eye surgery field in the world. With respect to surgery, LASIK eye surgery works by shaping your cornea into the shape of contact lens or glasses. So afterwards, you will be able to see as well as you do with glasses and contact lenses without wearing them. The principle of LASIK eye surgery is safety. LASIK eye surgery used to be performed with a blade. We introduced and performed the first bladeless or laser LASIK eye surgery in the state, in which we use a laser instead of blade to perform the surgery. The elimination of use of any surgical blade has raised the safety bar for the procedure and improved the quality of LASIK eye surgery. So bladeless or laser surgery, which, as I said, we introduced to the state, is the standard of care today for our practice. So basically, for LASIK eye surgery, we always need to keep in mind surgical safety and quality is the most important. As we have demonstrated through the publication of these textbooks that we have done, that it is eye surgery, it involves high-tech technology, so education and training of doctors so you can perform the surgery correctly is the most important.
For more information, call 615-321-8881 or wangvisioninstitute.com. This is an information update brought to you by Wang Vision Institute.
Last week, we talked about preoperative indication and LASIK surgery itself. This week, we would like to talk about postoperative complication and healing. We have recently published two major textbooks in the LASIK surgery field. One is corneal topography, and the other is irregular astigmatism. Irregular astigmatism is the most common, most important, and the most difficult to treat LASIK complications, which is responsible for a wide range of post-LASIK complications such as blurred vision, halo, starburst, and double vision. In this textbook, we gathered a group of world-leading scientists and researchers and developed sets of new technology that, in the best circumstances, can in fact help many of those patients who have these LASIK complications. When patients have LASIK complications, it's very important to identify where they should seek out those expertise. Doctors who have not only medical knowledge, but also high-tech laser technology knowledge in order to help them. Here at our clinic, we have patients from all over the world and the United States, referred here with LASIK complications. And with the technology that's described in our textbook, fortunately, we can help many of them. So this goes back to the fundamental of LASIK eye surgery. It's a surgery. Just like all surgeries, it has potential risk and complications. So the most three important things in LASIK surgery, you have to be the right patient, having the right technology, and see a right doctor.
For more information, call 615-321-8881 or wangvisioninstitute.com.